Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and doing well for your exams. Today we'll see the 5 important MCQ for the exam of AIIMS and JIPMER. Before entering the topic, we'll start with a small quote. The best way to predict your future is to create it. உங்களுடைய வருங்காலத்தை நீங்க தான் உருவாக்க வேண்டும். அதை பற்றி நினைச்சிட்டு இருந்தா மட்டும் பத்தாது, அது உருவாக்குறதுக்கான ஸ்டெப்ஸ் எடுக்கும். Okay, the best way to predict your future is to create it. Let's see today's 5 important questions. Today we're going to see about image-based questions. Very, very important nowadays in the NORCETs. In the JIPMER also, they are asking 1 or 2 image-based questions. So we'll see 5 important image-based questions today. Okay. First question. This is the logo of what? Diabetes, glaucoma, hypertension, stroke. So correct option is, it is the diabetes logo. The blue circle is the global symbol of diabetes awareness to help raise awareness about the diabetes in the community. To wearing this badge, okay, wearing this blue circle badge, which is creating the awareness about the diabetes. So what is the symbol of glaucoma? The green ribbon. It is a symbol of glaucoma awareness. What about hypertension? There is no particular hypertension awareness logo, but some books and some research are saying that, not research, some studies are showing this BP along with the monitor. It is a symbol for hypertension awareness. What about stroke? So this is a red color ribbon. It is indicating stroke. Don't confuse with the HIV. So there is a simple difference between this red ribbon and the HIV red ribbon. That means AIDS. So this stroke red ribbon is dark in color, whereas HIV AIDS ribbon is little lighter in color. So that is the main difference between the stroke ribbon as well as the HIV. That is AIDS ribbon, awareness ribbon. Okay. So don't get confused. Darker is stroke, light is HIV. Clear? Yes. So next question. This logo concerned with what? So this logo is about what? Mainly prevention of mother-to-child transmission of HIV, sexually transmitted infections, genetic counseling, family welfare. So what is the simplest saying? What is the simple? Where we can see this simple? This is Suraksha Clinic simple. This logo is a Suraksha Clinic logo. So what is about this Suraksha Clinic? It is mainly a STI. That is sexually transmitted infections and reproductive tract infections clinics. In the all over India, we have so many clinics are there. The main motto of this clinic is to control the sexually transmitted disease like HIV, herpes, gonorrhea, syphilis, chlamydia, and genital warts. So that is a main motto of Suraksha Clinic. So this is a logo of Suraksha Clinic. It is not about It is not about only the mother-to-child transmission of HIV. All over HIV, it is mentioning. So option C, it is not about genetic counseling. It is not about family welfare. So it is about STI, sexually transmitted infections. Clear? Suraksha Clinic. Next. This is the logo of national program concerning which problem? So options are child labor, geriatric health, iodine deficiency disorder, leprosy. So this is a symbol of NLEP, National Leprosy Eradication Program. Okay, that is, this logo is mainly concerned with the leprosy. Okay, so what is the symbol is telling? So the symbol containing lotus, house, okay, the rising sun middle, and a partially affected thumb. The lotus is representing the beauty and purity. The house is representing the hope and optimism. And the thumb is representing the leprosy patients. Can be useful for the member of society. The rising sun symbol is the hope and positive action in eradicating the leprosy. So this is a combining everything. It's related to the NLEP, that is National Leprosy Eradication Program. It is not about child labor, not about iodine deficiency, not about geriatric health. Clear? You can easily remember this hand. So leprosy otherwise called a hand sensitivity, right? So if you remember this hand, you can answer this question. So next image-based question. Name the program depicted by the logo. So this is, while seeing the logo itself, we can answer this, right? The students are having the plates. So that is related to the national program for midday meal in school. Okay. Midday meal program. So the simple is, okay. A midday meal is school plans to provide to children in government, that you all know in lunch period they are giving. Okay. That it is comes under Pradhan Mantri Poshan Shakti Nirman, okay, initiated from formerly midday meal scheme to improve their nutritional levels and support their eradication. So it's simple is about midday meal program. So what are the other symbols we have mentioned? Beti Bachao, Beti Badao, Integrated Child Development Service, that is ICDS, and Sarva Siksha Abhiyan. We can see it here. This is Beti Badao, Bachao and Beti Badao. பெண் குழந்தைகளை காப்பாற்று பெண் குழந்தைகளை படிக்க வைக்கிறத பத்தி வர்றதா இது. Okay, so this is ICDS, Integrated Child Developmental Scheme, and this is Sarva Siksha Ayurveda, right? Abhiyan, sorry, Sarva Siksha Abhiyan, mainly for education for all the childrens. Okay, yes. So this is simple is about ICDS. Next question. Which disease is not included in this program? So they given this logo, that is NVBDCP. What is NVBDCP? National Vector-Borne Disease Control Program. National Vector-Borne Disease Control Program. That is NVBDCP. So this program is containing mainly 6 disorders. So they are given 4 options. Which disease will not come under this NVBDCP? Options are chikungunya, Japanese encephalitis, Kala Azar, yellow fever. So except yellow fever, everything will comes under this program. So the wrong answer is yellow. The question they given not included. So what are the included? Malaria, dengue, lymphatic filariasis, Kala Azar, Japanese encephalitis, and chikungunya. All these are comes under NVBDCP, National Vector-Borne Disorder Control Program. Got it? So yellow fever is not coming under this program. I hope today's class was, so that's all about today's class. I hope it is helpful for you. So various logos are there. We'll see in upcoming class sessions about this image-based question, not only about community-based as well as practical-based image questions also we will bring it. So please read once again, revise it, and all the best. Thank you all.